All right, welcome back, everybody. With the return to the classroom comes the return of fall sports season. Many student athletes have already started practices for fall sports.
Yeah, it's important because you have to condition, right? But we've got some practical tips, I should say. Hopefully practical kids too.
As well.
Yeah, to keep your kids safe during the season because they're going back to school in the sports field and a lot can happen. So Dr. Hudson Seidel is an orthopedic doctor practicing with Comprehensive Orthopedics. Thank you so much for being here.
Thank you so much for having me on.
Now, you have a specialty.
Yes.
Tell us what your specialty is.
So I'm an orthopedic surgeon that's trained in orthopedics, obviously, but I also specialize in hand and upper extremity, so mostly from the shoulder down is more my specialty of practice.
Which is incredible. How did you know you wanted to do that?
Well, it's just something, I was really excited about the opportunity to see so many different types of patients, right? So I can see the young children that may have injuries on the athletic field or at the playground, and then I can take care of, some of my older patients as well that may have carpal tunnel syndrome or different injuries like that.
So, we're also doing the sign-up thing. Practices are starting
Yes.
even this week. And should we be mindful that maybe the kids haven't been conditioned all summer? Does that make injuries more likely?
Yes, that's something that's really important. We want to always make sure to be gradual in their return to sports, having a graduated process, making sure there's adequate time for recovery, things like that. The other thing I would say that's really important is there's been a lot of push for younger sports specialization, so single sports. When you look at the literature out there and the medical evidence, it actually shows that kids that move to a single sport too early are actually at a higher risk for having injuries both in adolescence but as they get older even at a professional level as well.
Like overuse. But what would be too early? What age?
So usually we talk under the ages of 12 to 14 is kind of an early age to do that. Now if they want to say play one sport almost exclusively, it's great to really then encourage free play as well. So having them go out and play in a more unstructured environment around the house or out and about is always great.
So that's interesting. So you recommend more than one sport for kids under the age of 12?
Yes, definitely.
That'll keep the parents busy. She's all choked up about that.
No, but, right, there are these kids who are really talented.
Right.
And they end up doing club sports and they're playing hockey or baseball like all year long.
Right.
And so you're saying that's a risk for more injuries?
It is just something that we see. There's more overuse injuries in that age group. So always, cross-training is great for development as well.
What kind of injuries do you see amongst these kids? What are the most common injuries?
I would say we see a lot of shoulder and knee injuries most commonly, and then for me as well, an elbow. So a lot of the pitchers have, the medial elbow pain, and then anterior knee pain we see a lot in our young athletes, running, things like that as well.
So as parents, what do we do to keep them safe? Like what's a tip for preventing injury?
Right.
So, as we talked about, something I think that can be great is also like a 10-minute stretch every day. I think it's going to be a really good thing.
Must be important.
And for all of us, we spend so much time hunched over the computers or screens all day. So taking that time to really making it a fun family experience is a great opportunity. The other thing I would focus on too is, small things like investing in a good backpack, right? Preventing, low back pain, things like that, trying to make sure that they don't put really more than 15 to 20% of their body weight in that backpack. All those types of things can add up over time.
Yeah, they put so much in there. I mean, I guess they don't, mine are saying they don't carry it around all day. They kind of leave it in their locker, but there's a lot in there.
There is a lot.
So what's the first thing you do when your child is injured? Do you say, if I had a kid, I'd say, hey, suck it up.
Yeah, no, that's a great question. So, right, there's...
No, you wouldn't.
And there's the...
No, I wouldn't.
I've heard of RICE,
Yes,
and tell us what RICE stands for. Is that a real thing? We should do it right away?
RICE is rest, right? Obviously take them out of the sport for a period of time. ICE, compression, and then elevation of the extremity are the kind of the just background things you can do right away. If it's an acute injury, you're worried about a fracture, something like that, you certainly want to get them seen within the first few days so we can get x-rays, get them further evaluated. And then if it's more something like you were talking about, the overuse injuries, right? That's going to be more of a nagging kind of gradual knee pain, things like that. I tell people, kids recover pretty quickly, so if it's not been a 3 to 4 week period and they're not getting any better, certainly come and see us because you would expect them to have something, some
especially
improvement.
if they're in pain.
Right, exactly.
The biggest question often is like, oh, what's broken or what's broken or sprained? Can you tell right away?
So the x-rays obviously help with that right away, but a lot of times, we want to get dedicated views, so they may not have that if they're not an orthopedist office, so I always recommend coming to see us specifically.
We can't tell by looking at it then.
I left my x-ray vision at home, unfortunately.
Yeah.
Where do parents go to get some reliable information?
That's an excellent question. So as a parent myself, I know it's so hard. We have so much information out there. So you know, the American Academy of Orthopedic Surgeons, or the big society we have, has a website called OrthoInfo, orthoinfo.org, and it's a great resource for parents to find really medically, you know, evidence-based stuff for them to guide them on kind of management of injuries and things like that.
Well, we can come see you too.
Of course, you can.
Absolutely.
Starting September 1st, I'll be available.
Oh,
Great.
that's wonderful.
Thanks, Doctor.
Terrific. Thank you so much for being with us.
Yeah.
Thank you so much for having me.
Happy and good health to you and your children.
To you as well.
And for more information, or if you want to get in contact with Dr. Hudson Seidel, you can visit comprehensiveorthopedics.com.
All right.